All right, good time of the day. Today we're going to talk about the topic that many people requested for a long time, and this is medical marijuana. First, I would like to tell everyone that we do have first-hand experience. We're certified since Ohio started the medical marijuana project. We will share our experience, but we will also share background so people can understand how we reach the conclusion we reach, and we do it as possible, as much as possible, as in an evidence-based and apolitical way. Thank you.
Hello, I've been coming to Dr. Margolians for 9 years, and before that, I struggled with pain. I have a rare disease, and he is excellent and knowledgeable about everything. And I love the clinic. I love talking with him just about everything, not just only the pain, but he's knowledgeable about medicine, vitamins, and he's just did me wonders.
My name is Kenneth Gaines, and I'm here at Dr. McGlonian's office, the best doctor on the planet. When I first came in here, I had so much pain I couldn't even do anything. Now I'm going fishing. I feel good about myself, self-esteem. My appetite is good. I'm sleeping good. Now I'm thinking about doing a whole lot of other things I didn't used to do. But thanks to Dr. McGlonian and the medicines and this technique and the friendly people and stuff that work here, made me able, plus they love me and I can't help for coming back. I feel better every day.
Yes, I've been coming here for about 5 to 6 months, and I have noticed I have been explained a lot more about pain. I've been given more detail than just coming in and being just medicated out and sent out the door. He goes through a lot of stuff about what can cause your pain. He encourages you to watch the videos to learn more. I'm losing weight. I thank God for that because I haven't lost weight in a long time. And I've lost about 22 pounds. And my friends can see a big difference in me, and so can my family. And I really appreciate it.
Hi, my name is Tammy Franklin. I am a patient with Dr. McGolian. He gave me my injections for my knees, and since then I was able to do more on my exercise and rehabilitation. I'm actually now on the treadmill for 20 minutes, the bike for 20 minutes. I'm doing 10 sets of squats. It works excellent.
Dr. McGolian told me about the medication zinc, vitamin C, D, and zinc. And on the floor in the prison, 160 inmates were sick with COVID, and they couldn't recover. And I told them about the vitamin C, D, and zinc, and now all of them are doing better. All of them are up and they're active, and they're all extra grateful about learning about this.
Well, in the first part, let's talk about what marijuana is. Marijuana is a plant called Cannabis sativa. It looks a little bit like that. Cannabis sativa has been known to humanity for thousands of years. And as an anecdote, it's known, for example, George Washington was growing marijuana in his farm. Luckily, before DEA and federal enforcement laws and so on. It was not seen for a long time as something criminalized. Again, I'm not taking position, I'm just giving you history. It was used actually for fiber, right? It was used as hemp. It was used for fiber, it was used for ropes, and actually to make canvas. The word canvas, to paint pictures, when you come to museums, canvas, it's related to the word cannabis, right? So it's been around for a while. It's been also used as dried part of the plants, as what we call marijuana. It was usually smoked or baked in brownies. I'm not giving anybody any ideas. I'm just giving history. And also the resin of the plant was used as hashish in many countries for hundreds of years. At the same time, till about mid-60s of the 20th century, nobody had any idea how marijuana works. Is it addictive? What are the side effects? And it was completely Wild West. Around mid-60s, the marijuana research started to pick up. Slowly they identified certain substances. In the 60s, 70s, and then 80s, they identified something called THC, delta 9 tetrahydrocannabinoid THC, which is well known and everybody knows for the drug screen. That's what people screen for, because that's the substance which is responsible for the psychoactive effect of the marijuana. However, the receptors for marijuana, how it works in your body, were not known for a very long time, I think till late 80s, early 90s. They identify a substance called anandamide, which is kind of internal endogenous, as we call it, cannabinoid. What it means that if marijuana works in your body, it has to connect to a certain receptor, right, to activate something. It means that this receptor exists in your body for a purpose, and there is substance in your body that is working in a similar way. Not to make things too complicated, I want to show this picture. To anybody who wants to remember physiology or high school biology or science, this called synapse, this called neuron, right? Presynaptic, postsynaptic. Let me take something. Presynaptic, postsynaptic neuron. This part called synapse, right? These are neurotransmitters. These are different particles that that activate receptors. Usually they're secreted from one neuron. They're stored in the vesicle and they activate receptors on the other postsynaptic neuron. And that's how the nervous system works. And this is called CB1. CB1 is the receptor for marijuana, for cannabinoids. And it's located not on postsynaptic, but on presynaptic receptor. Before these transmitters are released on presynaptic receptor. So that puzzled, and this is the endocannabinoid, right, that I discussed. So this system puzzled scientists for a while. It basically seems that what marijuana does, and this is marijuana or THC, it basically slows the release of these neurotransmitters. In other words, slows the firing of the nervous system. And it can be both what we call excitatory neurons that call activation of the nervous systems, or inhibitory neurons that cause the other way. So what does it do? Interestingly, one of the effects that was shown with marijuana is actually it's dose dependent. The effect is dose dependent and it can cause a relaxation. And one of the mechanisms suggested is it actually causes memory deletion. That's why it's so effective, for example, for post-traumatic syndrome. But it also causes a relaxation, has some analgesic effect, anti-nausea effect, right? At some high doses, it has psychoactive effect, which is associated with some disinhibition, inappropriate laughter, and really manic depressive episodes with sensitive individuals of high doses. There is a big debate in the scientific community how dangerous marijuana is. The studies, for example, showed in high school kids and college students that people who habitually use marijuana, they have low academic performance and less motivation, general and academic motivation. There was a serious concern raised that maybe marijuana is something called gate drug, meaning people who start using marijuana end up using heroin and some other heavy opioids and illicit substances. From the scientific point of view, correlation does not establish cause and effect. For example, if you see people who use marijuana have low academic performance, it does not mean that marijuana caused it. Maybe people with low academic performance wanted to use it. However, in my experience, I have people with legal degrees and medical degrees, and not necessarily the community I practice. So I try to be as anonymous as possible, practice in different states and different communities and so forth. But I have very intellectual people who use marijuana, but on average, there is a correlation. There is no doubt about it. And the same way, maybe people who have tendency towards the risk behavior in using illicit substances use marijuana, and they also would use more dangerous medications. Now, marijuana can be addictive, right? You can develop withdrawal after using marijuana. But interestingly, the proponents of marijuana point to an interesting phenomenon. This is nicotine. See, people who use the nicotine first time, they have high chance of getting addicted or keep using it. Cocaine is less addictive, alcohol is less, and marijuana is the least addictive substance, less addictive than alcohol and nicotine. However, and I'm not a big proponent of chronic use of alcohol, and definitely not nicotine. Nicotine is very dangerous from the medical point of view, association with the lung cancer, but marijuana is not that addictive and does not develop strong tolerance. Nevertheless, it does have a psychoactive component, depends on the type of the plant. It is associated with low academic performance. It is associated with higher frequency of illicit substance use. So now that's the introduction. So you need to understand it in order to understand what is reasonable. And I'll tell you my opinion, seeing a lot of patients, and mostly for pain management, okay? I have perspective of pain management. There are some neurologic diseases, maybe seizure diseases, maybe terminal diseases, maybe childhood diseases that I took courses about, but I don't treat them every day. So I'll give you most perspective about pain management. I think medical marijuana has its place. It's reasonable for people who've been on opioids or other chronic pain treatments without full relief. I would say for 6 months or more, 3 to 6 months or more, what we call chronic pain, under strict supervision to utilize medical marijuana in selective patients, strict supervision, and maybe with certain conditions, like we use it as adjunctive or opioid reducing medication, and so on, alternative to some extent. It's one tool in the toolbox. That's my perspective on it. It's not a miracle substance. It's one tool in the toolbox. It works very well for selective patients and not so well for others. Remember that insurances don't cover marijuana, and there is a significant out-of-pocket expense. And then there is a legitimate question. Let's say marijuana works for nausea or stimulate appetite, let's say an AIDS patient. That's true. But if it's not covered by insurance, and by the way, for these patients, there are tablets, Dronabinol or Marinol, that resemble active components of marijuana, that they may be covered by insurance. But if it's not, the question is, are there better alternatives? And this is an open question. So in summary, it's one tool in the toolbox. We use it very selectively. We're very neutral. We're not strongly for that. We're not strongly against it. I think people need to be screened. People need to understand pros and cons. Definitely people with psychopathology, high-risk people on multiple substances without proper monitoring, and so on. Maybe should stay away from that. It can benefit some people on the other hand, and provide additional functional relief and alternative to opioids or adjunctive to opioids in some cases. That's why, we screen people and we try to spend some time. I hope it answered the question. Thank you.